Good evening. My name is Laura Jacobs, and I'm a faculty member in the Human Services Department. What is the title of your position and what population do you serve? My title is Licensed Mental Health Counselor, or LMHC, and I serve a range of ages from 2 to 99. What is my educational background? I have a bachelor's in social work, and I also, several years later, went and got my master's in mental health counseling. What are my main responsibilities in a typical week? I see between 15 and 25 clients per week. Could be individually, could be family sessions or parent sessions. I also own my own clinical practice, and so I am responsible for progress notes, insurance billing, calling on insurance claims, or coordinating with doctors or various providers as well. What skills are necessary for succeeding in this position? I would say good listening, decent ability to communicate, definitely some ability to organize, and along all those lines, asking for help, particularly if you intend on owning your own mental health practice, um, or even if you're not, asking for help. Mental health counseling, human service work is a team sport. And so learning how to rely on your colleagues is very important. What do you find the most enjoyable about your work? I really enjoy, I've been in the field for about almost 15 years. And so I really enjoy getting to pull from my early cases, when I was kind of fumbling around, figuring out what to do, and kind of see now that I get to use all that wisdom and experience, or I'll even have particular clients come to mind, and those things still come with me. And I use those things that I've learned and am passionate about to help other people. I really enjoy that. What are some of the biggest challenges you face in this position or in serving this population? I think honestly, in our field, some of the biggest challenges involve allowing ourselves compassion to the degree to which we give compassion to others. I think that there's a great deal of stigma among providers, whether it's human services, social work, counselors, that we're not allowed to be human, we're not allowed to have boundaries. Um, and that's just not true. And so I think the biggest challenges often involve being kind to ourselves. What do you wish you had known when you first started working in the field of human services? Um, I think it took me a while to realize that, when I was meeting someone in crisis and feeling really intensely and anxious and overwhelmed, that the other person wasn't necessarily feeling the same thing I was. And that oftentimes the folks I was encountering had been in crisis for quite some time. That doesn't mean they were happy or calm, but it does mean that they were far more resilient than what I was giving them credit for, and that my panic was more about me than it was actually about the folks I was working with. What advice do you have for human services students or graduates about to enter the field? I would say find your niche, find something you like. There's lots of job opportunities, so don't feel like you have to stick with one thing in this field. I also would say, just remember that a lot of stigma for us comes from other professionals, and so don't be afraid to draw your line and to be the only one holding boundaries if you find yourself in that setting. That's okay, and that's really healthy and important to do, even if other professionals are struggling with that. Thank you so much, and best wishes.